Welcome back to our video series where we dive deeper into atherosclerosis, cholesterol, and the key factors driving cardiovascular diseases. In our previous video, we discussed why a cholesterol-free diet is generally unnecessary for preventing atherosclerosis. Today, we'll look at the second reason, identifying the true primary cause of atherosclerosis in your arteries. We're here to challenge a common misconception that cholesterol is the main culprit behind atherosclerosis and cardiovascular disease. Despite its negative reputation, the reality is much more complex. Join us as we explore why cholesterol isn't the primary cause of these conditions. We'll also discuss 3 key factors that actually influence the development of atherosclerosis and are crucial for maintaining heart health. Number 1. Inflammation. One of the key factors in the development of atherosclerosis is inflammation, not cholesterol itself. When the arterial walls are damaged by factors such as high blood pressure, diabetes and reduced insulin resistance, or smoking, the body responds with an inflammatory process. This inflammation leads to the formation of plaques, which are composed of cholesterol, fatty substances, cellular waste products, calcium, and fibrin. The presence of cholesterol in these plaques is a consequence of the body's attempt to repair arterial damage, not the cause of the damage. Research has also shown that chronic high blood sugar levels in diabetes can cause direct damage to the endothelium, similar to the effects of high blood pressure and smoking. Additionally, diabetes is associated with increased levels of inflammatory markers, which exacerbate the inflammatory response in the arteries. This makes individuals with diabetes more susceptible to the development and progression of atherosclerosis. Insulin resistance also impacts lipid metabolism, often leading to higher levels of LDL cholesterol and lower levels of HDL cholesterol. This imbalance further contributes to plaque formation and increases the risk of cardiovascular events. Controlling inflammation and insulin resistance is crucial to preventing and treating atherosclerosis. This can be achieved by controlling risk factors such as high blood pressure, diabetes, and insulin resistance, as well as making lifestyle changes like maintaining a healthy diet, exercising regularly, and quitting smoking. By understanding and addressing inflammation, you can better manage your cardiovascular health and reduce your risk of serious complications. Number 2. Type of LDL particles. Not all LDL particles are the same. The size and density of LDL particles can also significantly affect the development of atherosclerosis. Small, dense LDL particles, LDLB, are more likely to penetrate damaged arterial walls and contribute to plaque formation, while larger, less dense LDL particles, LDLA, are less harmful. There are at least 2 theories as to why small, dense LDL particles are more dangerous than larger, less dense particles. First, small, dense LDL particles can more easily squeeze through the tiny gaps between the cells in the endothelium, the thin layer of cells lining the inner wall of the arteries, reaching the inside of the artery walls. Second, small, dense LDL cholesterol particles are more susceptible to oxidation, and the oxidation of cholesterol contributes to the formation of cholesterol plaques. Due to these characteristics, small, dense LDL cholesterol particles are associated with accelerated atherosclerosis and a 3-fold increase in the risk of coronary heart disease. This type of particle is considered a major cause of atherosclerosis in people with normal or near normal total and LDL cholesterol levels. In addition, people with predominantly small, dense LDL cholesterol particles often have low HDL cholesterol levels, elevated triglyceride levels, and a higher risk of developing high blood sugar and type 2 diabetes. The focus should be on reducing the number of small, dense LDL particles rather than simply lowering total LDL cholesterol levels. While the size of LDL cholesterol particles is primarily determined by genetics, diets low in saturated fat, regular aerobic exercise, and weight loss have been shown to reduce the number of small, dense LDL particles and increase the number of large, less dense LDL particles in the blood. If lifestyle changes are insufficient, medications can be used. Although statin medications are effective in lowering overall LDL cholesterol levels, they have a limited effect on the size and density of LDL particles. Medications like nicotinic acid and gemfibrozil have been found to be effective in increasing the size and density of LDL particles in many cases. Number 3. Genetic mutations. Apart from the aforementioned two factors, specific genetic mutations lead to atherosclerosis as well. Changes in the LDLR gene are the most common. The LDLR gene provides instructions for making a protein called an LDL receptor. This type of receptor binds to LDLs, low-density lipoproteins, which are the primary carriers of cholesterol in the blood. By removing LDLs from the bloodstream, these receptors play a critical role in regulating cholesterol levels. Some mutations in the LDLR gene reduce the number of low-density lipoprotein receptors produced within cells. Less common mutations, such as those in the ApoB, apolipoprotein B, LDL-RAP1, or PCSK9 genes, lead to the production of abnormally functioning LDL receptors. Consequently, mutations in any of these genes disrupt the receptor's ability to remove low-density lipoproteins from the bloodstream. As a result, individuals with these specific genetic mutations have very high levels of blood cholesterol. The excess cholesterol circulates through the bloodstream and is deposited abnormally, contributing to the development of atherosclerosis in the arteries. This can lead to cardiovascular diseases such as heart attack and stroke. These genetic mutations affect approximately 1.3 million people in the US, but only about 10% are aware that they have them. Researchers are working to identify and characterize additional genes that may affect cholesterol levels and heart disease risk. Some of these conditions can be treated with lifestyle changes. Alright, these are 3 factors that can influence the process of atherosclerosis. As we mentioned here and in the previous video about the causes of cardiovascular diseases due to atherosclerosis, the primary cause of atherosclerosis is neither your dietary cholesterol nor your blood cholesterol. To dispel the common misconception about cholesterol, the next video will explain why cholesterol is essential to life. It plays a critical role in thousands of bodily functions. Want to know why and how? Stay tuned. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.